And I think, and actually Juicy went with me, was, so we went to this family who had just moved to the United States, a refugee family, had been here, I believe at that time, a year and a half or so. And we had asked about a vacuum, and Mom pulled out a broom, and she was using the broom to vacuum the carpet. Her child had asthma, and the nurse was able to we were able to get a vacuum for her, and showing her how to use the vacuum. And then just seeing how she lit up and having to teach her, or even when I put the suction to her hand and her even being scared to put her hand, she didn't know about the vacuum. She didn't know how to use it. And even though it was the smallest thing in the world, to her it meant a lot. And to me it meant a lot just to be able to show somebody who had never seen a vacuum how to use it and just being grateful.
And to improve health outcomes.
Mm-hmm.
Yes.
So I'm in charge of quite a few programs. One is senior wellness, one is diabetes prevention, but I think the most rewarding one was one that did have to do with hypertension. And the family had found out that I was giving out blood pressure monitors, and they called me and they wanted me to come to them because the dad was just getting out of the hospital having had a stroke. So that was the reason they weren't coming to me. So when I did the presentation, a lot of people, so African Americans have the highest blood pressure of anyone on the planet, okay? So we're working on that disparity. Some people, so I've been to health fairs and outside fairs where I'm standing in the middle of the street saying, would you like your blood pressure taken? A lot of African Americans think that's normal, you know, that 150 over 95 is normal. So I go in this house and I gave them hope because here the dad just had a stroke, the mom is there, she's got high blood pressure, they have 4 kids and then some grandkids and they're all there. So I'm talking to 3 generations of people, bringing them the information, no, 120 over 80 is normal for everybody. And even though you've had a stroke, you can control your blood pressure. If you take your blood pressure at home every day, you can control it. And we talked about exercising and some of the things that you eat, and I think even at the time the whole Black Lives Matter was about, and regardless of how you feel about that, I was saying, yes, Black lives do matter, and they matter in your kitchen and at your table. And you have a lot of control over your own life. And so I really left feeling like I gave them hope. And that I really was affecting 3 generations. And so, yeah, you had a stroke, but that doesn't have to be the end. You can control this. And I think sometimes when we're dealing with health outcomes, you're dealing with people who feel helpless. Like, I have this, and there's just not anything that I can do. So I think that was probably my most rewarding one.
That's awesome. I don't have a specific one because I have a few that they're all related to the fact that I'm out there saving lives. You know, and when I find out that a sister is diagnosed with breast cancer because her sister has been diagnosed with breast cancer, and she's older, you know, and so it's like, and if it was not for the fact that I didn't give her a choice, I grabbed her and I said, well, you're coming with me. You know, and I just grabbed her and said, you're getting a mammogram tomorrow. And so, and she was diagnosed with breast cancer at a later stage than her sister. And so those kind of situations are very rewarding for me because I see the outcome. And I see that this woman is alive because I was doing something about it. You know, and I didn't sit back and say, oh, you know, you should really get a mammogram. That kind of attitude. I said, no, there are situations where, you know, you have to be a little bit more assertive. Not aggressive. Don't tackle them to the floor and drag them. But because, you know, she's there supporting her sister, I said, you're here supporting your sister, you know what? Let's go and make sure that you are okay as well. And so I always say that story and say that I grabbed her by the arm, but she probably grabbed me and ran with me, you know. And one last one is, I had a patient who I'm the one who told her that she had a late-stage cancer. That's the other thing, I never do that anymore. Because she held it against me. And so I felt like she was very uncomfortable around me. And then when I was moving, I don't know if I told you this, Patty, I found a letter from her. And how, I'm gonna try not to get emotional.
You're gonna make it sound.
I know. And she wrote me this lovely letter thanking me. The whole time I'm thinking she was angry and the whole thing, she goes, no one helped me like you helped me. So those are the times when you get those little letters, save them, because you never know when you're gonna need them. And